When I was in first grade, I was so excited to start learning addition. My mom is a pharmacist, and since I wanted to be just like her when I grew up, I knew I needed math to be successful. I worked really hard too, and soon I was adding numbers together like a pro. However, my grades didn't quite reflect the enthusiasm I was displaying for this subject. It turned out that amid all my hard work, I was transcribing the numbers incorrectly from the chalkboard to my paper because I simply couldn't see them. Fuzzy 6s became 8s, blurry 2s became 7s. You get the idea. If my teacher wrote 7 plus 9 on the board, I'd shout out 9 since the sneaky 7s had become 1s and the 9 had morphed into an 8 through my myopic vision. Thankfully, my first grade teacher noticed my intense squinting and the odd transformation numbers underwent between the chalkboard and my paper. She recommended my parents take me to see an eye doctor. My math mishap was easily corrected with a pair of glasses. Does this story sound familiar? Perhaps it's something that happened in your own life, or the life of one of your friends, siblings, or children. About 41.6% of Americans are nearsighted, or myopic, and 5 to 10% are farsighted, or hyperopic. That means about half of our country needs corrective eyewear to see properly, and that's not even factoring in the 80% of older adults who have a near vision impairment due to age, which is also referred to as presbyopia. Rather than waiting until you can't read the departure time on your airline ticket, miss an exit on the interstate while road tripping, or even have a math mishap like me, it's better to take preventative action and ensure you have a wellness eye exam performed each year, regardless of whether you need corrected lenses or not. Routine eye exams are important for so much more than just making sure your life is in focus. Eye and vision disorders in children can adversely impact a child's development, school performance, self-esteem, and social interactions. Routine eye exams for children can catch conditions such as amblyopia, strabismus, convergence insufficiency, and even diabetes before they adversely impact a child's vision and development. Optometrists and ophthalmologists typically recommend children see an eye doctor for their first eye exam when they are 6 months old to ensure their eyes and vision are developing normally. Many insurance companies, including VSP and Medicaid, will fully cover these appointments. Eye exams aren't just for kids. After all, it really helps to have your vision at peak performance when you're trying to file your taxes or master Ohm's law in your physics class. Routine eye exams for adults can uncover conditions such as cataracts, glaucoma, macular degeneration, and dry eye disease before they adversely impact your vision in life. Early detection is key to properly managing or treating many of these conditions. Let's break down what a typical eye exam looks like. The order of an eye exam may vary depending on the clinic you go to, so don't worry if this doesn't exactly match what you have seen before. The goal of this is just to demystify the annual eye exam experience and allow you to become an active member of your visual and ocular healthcare team. When you first arrive for an eye exam, you may be asked to fill out a patient health and family history form. This form allows your eye doctor to learn how you currently feel your vision is doing and alerts them to the likelihood of you developing any certain conditions or diseases. For example, the commonly used acne treatment, Accutane, can lead to increased eye sensitivity and dryness. If your eye doctor sees this on your list of medications you're currently taking, he or she may take extra time to check and see if you have any physical signs or symptoms of dry eyes. Similarly, a family history of glaucoma can increase your risk for the disease by 4 to 9 times as much as the average person. If this is on your patient health and family history form, your eye doctor will pay extra attention to your ocular pressures during your appointment. The next part of a typical eye exam is considered a preliminary examination, also referred to as pre-testing. This may include an acuity test, tonometry, autorefraction, and visual field test. An acuity test is that chart with lots of little letters that is placed a set distance away from you. The optometrist or technician will ask you to read the smallest line you can. The line you can read accurately will give your provider an idea about how your vision is doing. The next test you typically see during an annual eye exam is tonometry. This test checks your ocular pressure, or the pressure of your eyes. A normal ocular pressure falls between 10 to 21 millimeters of mercury. High ocular pressure may be indicative of additional pressure on your optic nerve, the development of glaucoma, or even poorly managed systemic hypertension. By catching a high ocular pressure early, your eye doctor can prescribe eye drops such as latanoprost to lower your ocular pressure, or they can refer you to your primary care physician to manage your systemic hypertension more effectively. Your next test is an autorefraction. An autorefraction is the test where you see a picture of a farm or hot air balloon go in and out of focus. This machine measures the shape of your cornea, or the clear surface on the front of your eye, and your retina, which is kind of the inside of the back of your eye. This test determines where the focus point should be for your vision to see most clearly. It's incredible for giving eye doctors a quantitative idea of what prescription may be most beneficial to you, or if your contact lenses are working properly. The final component of pre-testing is a visual field test. This one may feel like a really old school video game if you take an automatic test on a machine, or you just may be asked to stare at the technician's nose while they have you identify how many fingers they are holding off to the side. A visual field test breaks your vision down into sections to evaluate how far you can see to the sides, above, and below without moving your eyes. If you have trouble seeing in a certain section of your vision, you may be developing a condition such as macular degeneration. Once you've made it through pre-testing, you finally get to see the optometrist or ophthalmologist. Your eye doctor will review the results of your preliminary examination and perform a refraction and ocular health assessment. They use a phoropter to identify the prescription that would be best for your eyes, and a slit lamp and an ophthalmoscope to examine the surface and inside of your eye. With how incredible and important annual eye exams are, why do some people just not go? The American Optometry Association reports in their 2015 clinical guidelines several of the most common reasons people don't go to the eye doctor for their annual eye exams. First, and perhaps most prevalent, is the financial expense or a lack of insurance. Vision insurance definitely helps cover the cost of a routine eye exam, and without it, you could be looking at an expense anywhere from $50 to $250. If you're in this boat, there are a couple things you can do. First, if you are lucky enough to live near an optometry school, there are often free clinic days where you can get your eyes checked by optometry students. Don't worry though, the students are closely supervised by fully licensed optometrists and you will still get excellent care. If you don't happen to live near an optometry school, there are still a couple other options. Some big box retailers, such as Costco, Target, and Walmart, actually don't take vision insurance at all to keep costs down for patients, which will allow you to receive an eye exam for around $70. If you're a patient at a private clinic instead, let the receptionist know you will be paying for the appointment out of pocket as soon as you arrive. Many private clinics will give you a slight discount if you're paying out of pocket and pay in full the same day as your exam. Finally, Medicaid and Medicare offer varying levels of vision coverage depending on your age and the state you live in. The second reason many people don't receive an annual eye exam is because they don't think it's that important. However, a comprehensive pediatric or adult eye and vision examination is an important evaluation of an individual's overall health status. Remember all those conditions I mentioned a routine eye exam can catch before they progress too far? Well, annual eye exams will ensure you get timely treatment if necessary and keep your vision in top shape. Another reason some individuals don't go in for an annual eye exam is because they or their child already received an eye examination that year, either at the pediatrician's office or at the DMV. The eye exam your child received at the pediatrician's office, or the one you took while renewing your driver's license, are actually considered visual acuity tests. Remember that Snellen chart we talked about a little bit ago? That's just a tiny component of an eye exam. While these tests are great for ensuring you are seeing okay and sending you in the right direction if you do need to go visit the eye doctor, they aren't comprehensive eye exams that actually look at the health of your eyes. Finally, some people avoid going to the eye doctor because they hate the dilating eye drops or tests. I get it. Eye drops aren't always the most fun. However, the fields of optometry and ophthalmology are constantly evolving, and tests are becoming increasingly streamlined and more comfortable for patients. If you really don't like eye drops or a certain test, let your eye doctor or the technician know. Sometimes there are alternative tests to check the same aspect of your visual health that you may find more comfortable. You also may not have to receive dilating eye drops every year, depending on your vision and ocular health. Imaging equipment, such as the OptoMap, is becoming increasingly prevalent. I kind of think this piece of equipment looks like Baymax from Big Hero 6, although that might just be me. Just like Baymax, the OptoMap is definitely a benefit to your health. This machine allows your eye doctor to take a photo of the inside of your eye through your pupil, saving you from the sting of dilating eye drops and allowing your eye doctor to track your ocular health over the years. Don't wait for a math mishap like me to visit your eye doctor. Annual eye exams are an important step in managing your overall health and wellness. I hope you make annual eye exams a priority for you and your family starting this year. After all, eye exams are a great way to keep your health and life in focus.